In this video, I will explain what disorganized attachment is, how it develops in childhood, how it presents in our life, and how we can heal it. So if you've started your journey to greater self-awareness and are healing your past, you're in the right place. So as children, we adapt to the circumstances that we find ourselves in. If our parents and caregivers are present and attuned, can make sense of our internal states and respond in a timely and appropriate manner, we develop secure attachment. We feel seen and appreciated in a very deep way, which allows us to seek security in our caregivers, but also that safe base to explore the world. However, if the circumstances of our upbringing were not as optimal, we adapt. In avoidant attachment and ambivalent or anxious attachment, we're insecurely attached to our caregivers. These are forms of insecure attachment, but in all of these examples, secure attachment or insecure avoidant or insecure ambivalent, we have a blueprint for attachment, an organized strategy of how to attach to a parent or caregiver. In the avoidance strategy, we have unconsciously decided to count only on ourselves, so that we withdraw in order not to feel the deep pain and disappointment of not having our needs met. Or in ambivalent or anxious insecure attachment, our attachment system is revved up, so we cling to our parents and not dare to explore. We're preoccupied with the attachment, still hoping to be seen by our parents as we become adults. But so what happens when we simply lack this relational blueprint? When there is no organization, no strategy behind our attachment? This is what is known as disorganized attachment. Disorganized attachment develops in childhood when we experience fear without solution. I will say this again, and it may perhaps be triggering to your nervous system, but that is for good reason. Fear without solution is terrifying. So if as a child I was hit or beaten, or if I witnessed a sibling being beaten, or I experienced my parents fighting in such a way that I was terrified, if I was punished by being locked in a cupboard or in a basement, or if a parent was regularly drunk and unpredictable, if there was extreme neglect or abuse, whether sexual, physical, or emotional, these are all experiences of the caregiver being terrifying to me, their child. And this has a very specific effect on us. There is one part of us, the most primitive part of the brain, the brainstem, that tells us that when faced with fear, we move away from the source of fear. And physiologically, we're put into a fight or flight mode to escape the frightening situation. And at the very same time, we have the limbic system, the middle part of the brain, which governs the emotions and the attachment, which says that when fearful and threatened, you go to your caregiver, your parent. But this, of course, breaks down when the caregiver is him or herself the source of the threat or the source of the fear. So we find ourselves as children in this impossible situation of being terrified by a caregiver who's at the same time supposed to be the source of safety, to whom we're programmed to run for protection. So what this dynamic leads to is a fractured sense of self. So to contrast this to the avoidant insecure attachment, which could be seen as a disconnected sense of self, and the ambivalent insecure attachment as a confused sense of self, the secure attachment is having a coherent sense of self. The disorganized attachment is having a fragmented sense of self. So in the strange situation, the baby is seen as wanting to approach the caregiver on reuniting, but at the same time wanting to withdraw, often resulting in incoherent behaviour, such as collapsing or biting a finger or hitting your head against the wall. So, as children, those with disorganized attachment will find it difficult to feel their needs or ask for help, and will not be able to regulate their emotions. They will have difficulties in maintaining rational thinking when there are a lot of pressure, and have difficulties in their relationships. But most importantly, and we see this also in the adults with the disorganized attachment, there will be dissociation, a feeling of just not being there. And of course, if the neglect or abuse was severe, the dissociation could be extreme in the form of dissociative identity disorder or multiple personality disorder. So to heal from disorganized attachment, we need to do the reflective work. We need to deal with these unresolved experiences that might have been terrifying to us as children. And what I would invite you to do if you feel like there is an unresolved trauma in your past is to speak to trusted others about it, or even just to journal about it. So reflect on what you remember from your past and how these experiences have shaped you as you are now. And I want to share with you an important finding, that parents who have had traumatic experiences in their past and have been terrified by their parents or caregivers, if they have made sense of their experiences and are able to talk about them in an integrated way, they're not likely to pass on the disorganized attachment to their children. It is our unintegrated trauma and loss that keeps us stuck, that causes us unconsciously to react in such a way to our children that makes them terrified of us and perpetuates this pattern. So, for example, if you've not integrated and made sense of the childhood experiences of, let's say, your father screaming at you and making you terrified, you are likely to be triggered by your toddler who starts screaming and refusing to cooperate. And these unintegrated traumatic memories will flood your system, and you will find yourself screaming at your child instead of calmly helping them. And the tricky thing about these emotional memories that flood our system from the past is that they're not labeled as old. They are known as implicit memories, and they're triggered in the present, but are in fact a reaction from a childlike place of helplessness and despair from a time when we were little and terrified. So with expanding consciousness, being clear-minded in these moments when we react rather than respond, we can learn to identify our own wounding and tend to it, so we do not pass on this disorganized attachment and heal it in ourselves. Please subscribe to my channel if you would like me to accompany you on your journey, and please share your experiences. I really like hearing your insights. Thank you for watching.